these are the treatment options for stage 2 prostate cancer. So stage 2 in most cases means that not only is there potentially a biochemical elevation in the PSA level in a range where it's abnormal, and it also usually includes that the patient has some sort of prostate exam that is abnormal, where the doctor is telling them, I feel a lump or a nodule on the prostate, that in most cases will correlate to, when they do a biopsy, to the finding of cancer in those areas. In those instances, the decision making for treatment again involves the following. Usually it involves potentially surgical removal of the prostate. The one benefit of that therapy is that we would potentially better stage that patient once the prostate gland is removed. And what I mean by that is, when the prostate's removed, the pathologist has a chance to look at the tissue under the microscope. Then they can sort of look at it and tell us whether or not the cancer has extended outside of the prostate, or is it confined within the prostate. If it's within the prostate, then in most cases, more than likely we're looking at a potential cure. However, if it's outside of the prostate, then the patient may need further treatment, and so that is potentially one of the benefits of surgical removal. The other option also includes radiation therapy, where radiation can be delivered externally from a source directly into the prostate to destroy the cancer, or you can also apply radioactive pellets that can be placed within the prostate itself to destroy the tissue. Finally, there's also a treatment called cryotherapy, where probes are placed within the prostate itself, and a treatment is performed on the prostate to freeze and kill the tissue. These probes are then removed after the treatment, and then it is usually a therapy that is done as an outpatient therapy.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.